The other impact of the expansion of the body of the mandible is lifting up platysma and all the suprahyoid bones. And when they get stretched about 10 millimeter, it is going to be lifting the uh, hyoid bone, which is very, very important for support of the hypoglossal or below the tongue space.
That's fascinating. So you're saying that your Dame procedure, where you're expanding the mandible, is actually lifting up the soft tissue that can often be responsible for sleep apnea?
That's right. It is not only soft tissue, is platysma, is the muscle, and also all the supporting muscles underneath the tongue and over the hyoid bone.
So this really doubles the effect of
Yes,
expansion on sleep apnea.
that's right. And you see it here. See this muscle, so this is called mylohyoid muscle, right? And these are the muscles that they are going to get stretched, and in a way, they are going to lift the tongue also.
So I know of a doctor in the LA area. His name is Dr. Kazarian. He's a ENT, and he is a proponent of DICE, drug-induced sleep endoscopy, where he's sedating the patient, and then he's sending an endoscope to try to identify where the blockage is that's causing the sleep apnea. The idea is that
Yes,
the sedation is mimicking sleep, and he is a pioneer of these procedures where he will, stretch. He'll pull up some of this stuff in here to get it out of the airway without even doing a Bimax surgery. He'll do a soft tissue surgery where he's stretching this stuff out to cure sleep apnea. So you're saying the Dame can do that more naturally.
yes, it is a capability of them to do that. It's not going to be as effective as junior glucose advancement, meaning that junior glucose advancement, when they bring the tubercle forward in the body of the mandible, which is right in this area, the junior glucose tubercle attached
Can
here,
you lift the
and
model
then
up,
when
doctor?
they
Bring the model into the frame. Oh, you're showing
actually,
on
I
the.
need to show you here. So this is the genioglossus muscle. Run. I'm pointing to it. So attached to the back of the body of the mandible, right in front area. So genioglossus muscle attached right here. All right. So and then when they bring the chin forward or genioglossus tubercle forward, is going to stretch the hyoid bone forward. Another procedure that they do, and we do a lot of it, is called hyoid suspension. So they are going to grab and put some wires around the hyoid bone and then pull it forward. So a similar thing that this distraction osteogenesis Dame does, although is not as effective as hyoid suspension, or but it can have some effect like that.
It's a step in the right direction, and you would recommend
Yes.
the patient start with skeletal expansion and then see how he feels before going into a procedure with an ENT.
That's right. Yes.
Mm-hmm.
So this from the minimally invasive procedure. So we have had patients that, for example, starting he's a physician. He had 72 AHI, severe sleep apnea in his 30 AHI, and he had 72 AHI. So what we did, we started with Dame, and Dame dropped his level of the sleep apnea to 26 AHI. Now he was already scheduled to do the MMA surgery. So reducing the AHI so much, we decided that why don't we do the expansion of the upper, which we tried the main and did not open. So we had to do this surgery, which we call that procedure DANE, is distraction assisted nasomaxillary expansion. He expanded his maxilla, and then the AHI dropped to 11. And now we are not going to do MMA for him. He had some deviated septum, turbinates a little bit large. So he had the turbo reduction and septoplasty, and I'm holding my finger crossed that that has cured the sleep apnea. He's still wearing the apnea TX for management. So that's the example of how this can work.